All right, hello and welcome guys. In this video, I will be discussing what the lifetime value of an average patient of yours is and why it's so important, okay? This is one of the most important videos that you will probably get to watch if you want to double your revenue for your dental practice, right? So what generally happens with dental offices is that the practice owners think along these lines. They say that, well, if I'm spending $300 or $200 or $400 and it brings in a new patient for me, and that patient pays me $800, I have made some money. And that's pretty much the end of the story as far as they are concerned, right? This happens around 80 to 90% of the time, okay? Most dentists they either don't know what the lifetime value of their patients is, or they just have not incorporated it into their business model. And I can tell you from experience that the top dental offices, they always look at the lifetime value of their patients, okay? Because they have systems which keep bringing these patients at least two times in a year for the next 7 to 10 years or 20 years or 30 years. I know people who have been going to the same dentist for the last 30 years. Okay, and they still rave about that particular dentist. They really love going to their particular dentist. That's why they don't change. I know people, they don't change their dentist. I know people who drive an hour or an hour and a half to go to their favorite dentist. Okay, so once again, if you are currently just using the transactional value of every new patient, you probably are not generating a lot of revenue. Okay, let me say it to you another way. The top dental offices, their entire business model revolves around knowing that every single one of my patient is going to generate such and such revenue. All other dental offices, they look at the transactional, the short-term value of their dental, like of their patients. Okay, now let me give you an idea of what the lifetime value is. The lifetime value of your patient is simply how much they're going to spend with you for as long as they keep going to your dental office, right? For some dentists, it would be 7 to 10 years. If you're really, really good at what you do, and if you give your patients a really good experience and really good care, they'll keep coming in for the next 30 years. If you look at the reviews for the top dental offices, their Google reviews, you will see many people saying, I've been going here for the last 25 years or 30 or 40 years because I love this dentist and their staff is amazing. Okay, right? So that's why when dental practices start looking at the lifetime value of a patient, then the way they market their practice totally changes, right? They're not looking at a transactional value anymore. They're looking at how much that patient will bring over their lifetime. So as an example, if you're a general dentist, each of your patients, if you do a really good job and you have systems implemented, every single patient should be worth at the very least $5,000 to you in the 7 to 10 years that they come to you. Okay, if you get them to keep coming in for 20 or 30 years, the lifetime value dramatically increases. I'm sure you're calculating numbers in your head right now. Okay, what I'm trying to say is that whenever you spend money on marketing, you should not be looking at the transactional value. I always ask dentists, I ask them, how much do you think the lifetime value of your patient is? They almost always say $400 or $600 or $800. That is wrong. That's the transactional value. It's not the lifetime value. Okay, the lifetime value is $5,000 to $8,000 if you're a general dentist, probably more. If you do full mouth reconstructions or something similar to that, the lifetime value is $20,000 to $45,000, probably more. If you're an orthodontist, the LTV or lifetime value is somewhere around $6,000 to $12,000 or $14,000, right? The lifetime value does not include how many referrals you are going to get. If someone's happy with the care that you've provided to them, they're going to refer other people to you, their spouse, their partners, their children, their relatives, their friends, whoever it might be. If people are really happy with you, they are going to refer at least 2.2 people every single year to you. This value, these referrals do not go into the lifetime value of that particular patient, which means that the potential revenue you can generate if you have the right business model is way higher than the lifetime value I am talking about right now. Okay, this is the major distinction between a normal dental practice and the one which is pretty much dominating the region, or at least the city. If you look around, you will see 2 or 3 dental offices in your city that are really killing it, you know? They're everywhere. People are raving about them. They keep getting patients in 2 times a year for the next 20 years or 30 years. Because why? Because they have a system. They understand what the lifetime value of their patients is. They're not relying on the transactional value. They understand the value of referrals. They have a system which keeps bringing these people in every single time. They market everything properly, okay? And they're probably generating at least 6 figures a month, at least, okay? So I hope you can kind of get the distinction here, okay? Looking at a patient and saying, well, you know, he's going to just spend this much with me when he comes in, or looking at a new patient and saying, well, over the next 7 to 10 years or 30 years, if I do a really good job, I'm going to generate so much revenue, right? So this is exactly what we work with our clients, right? We implement the processes and the systems and the marketing and pretty much everything for them, so that they stop doing what they're doing right now, and they literally transform their dental practice. It sounds simple, but it's not. Otherwise, many more people would be doing it. It takes hard work. It takes some trial and error. There are many variables to it, but if you're willing to put in the time and the money in it, you can probably dominate your entire city. Okay? So remember, always the lifetime value of your patient, never the transactional value. Okay? And depending on what you do, and if you do any specialized procedures, which you probably do, for example, if you're doing implants or veneers, implants, crowns, full mouth reconstruction, all that stuff, Invisalign, braces, any of that stuff, the lifetime value of your patients is pretty high. So please spend more on marketing and have a system in there. I can personally help you out, but some time and effort and investment is involved. Okay? So I hope this video gave you some insight, and as always, if you have any questions, please let me know. I'd be happy to help. Thank you.